We have got an army of 271,000 people, 606 on the ground in the 27 districts fighting HIV and AIDS. 256,452 are funded by us as South Africa from our own fiscus. That leaves us with 15,145 people. Those are the ones who will be affected by whatever withdrawal is there. Now, how is the funding conducted? 76% of the funding is from South Africa, 76% of the funding. 74% by the government, fiscus, and 2% by the private sector. That includes medical aid. All the medical aids in the country are contributing 2% to the fight against HIV/AIDS. Otherwise, the rest is government. Now, obviously, as you can see, that leaves us with a gap. And that gap is filled by Global Fund, which gives 7%, and PEPFAR, which gives 17%. So when you add Global Fund and the government of South Africa, or the South African either government and private sector, when you add them, you realize that is 83%. So PEPFAR remain with the 17%. That's where our problems are. Now, we are buying ARVs on our own with 10% from Global Fund, which is not affected by this. I'm sure you are aware. Global Fund is an international organization in Geneva. We are buying on our own. So our biggest problem will be the salaries and the operational costs of those people that I've just mentioned. That's what we are trying to look at with Treasury. We're supposed to have a meeting yesterday, which could not happen because they were preparing for this Lekgotla, as you'll understand. Lekgotla is mostly a Treasury thing. But they said we must write a dossier and send it to them. We have just finished that dossier. We have sent it to them, showing some of these things that I'm actually telling you about here. But up to so far, we haven't received any letter from the American government. This money, whether from Global Fund or PEPFAR, it comes through Treasury. Treasury has got no letter. Health has got no letter. DERCO has got no letter. Tried to contact the embassy of the US. We couldn't get them. So how do we know that there is this funding withdrawal and all that? Because the actual NGOs and the clinics that are funded from this PEPFAR were the ones who received letters, as you know. But this morning, we read again that the Secretary of State has withdrawn that for the time being because they say they are going to review for 90 days. So it's still a little bit fluid as to exactly which way are we going. But we believe for now, all programs continue. As South African government, one thing we want to ascertain is that nobody must stop taking ARVs, because that will be devastating. It will be completely dangerous. As you know what happened. When you are on ARVs and you stop, there will be serious trouble.